Hello, everyone, and welcome. Thank you so much for taking time out of your day to join us for today's NeedyMeds special topic webinar, Maximizing Patient Assistance Programs, Access and Adherence, presented by our partner at Medvantx. So bear with me, everybody. We just want to make sure we are recording today's presentation. So just bear with me. Great, we are being recorded. That's great. So let me go ahead and get this back up to slideshow mode. And again, welcome everybody. So my name is Carla with NeedyMeds. And again, we are here to present for you a presentation all about maximizing patient assistance programs. So before we kick off the presentation, I'm going to offer a few tips so you can make the most of it. First of all, we encourage you to submit questions throughout the presentation by typing them into the chat section of your Zoom control panel. But we do keep the question segment short. So if you ask a question and we don't get the chance to answer it, we will follow up with you by email. And we will provide our contact information for Medvantx and NeedyMeds throughout the presentation, as well as at the end. I'm happy to report and confirm that today's presentation is being recorded, so you can rewatch it, share it with others, and you can find that on the NeedyMeds YouTube channel. So before we get into why everybody's here, which is to talk all about PAPs or patient assistance programs, I just want to make sure everybody knows a little bit about both NeedyMeds and Medvantx. NeedyMeds is a national nonprofit co-founded about 25 years ago by retired family physician Rich Sagal and his friend Libby Overly, who was a medical social worker. And what you're looking at on the screen is our mission statement, but simply put, NeedyMeds connects people with healthcare savings resources. We do that free and anonymously through our website, NeedyMeds.org, and our helpline, 1-800-503-6897. And again, we will have that contact information up at the end of the presentation. So one of the most important resources we offer on NeedyMeds.org, and if you reach out to our call center counselors, is our robust listing of patient assistance programs, which why we're so pleased to have experts on the topic join us today to explain everything you need to know about them. Now, before we dive in, I'd just like to introduce Medvantx as well as their representatives that are going to be doing all of the heavy lifting today. So first of all, those of you not familiar with Medvantx, they are, as I said, a NeedyMeds partner, and they are a non-commercial dispensing mail order pharmacy that has a mission of connecting patients, providers, and healthcare companies, and also people that drive by on the train. If you heard that in the background, even they can be connected with patient assistance programs. But again, they do work to connect patients, providers, and healthcare companies. They work with them to enhance access and improve lives. They deliver on this mission through partnering with pharmaceutical manufacturers to enable fulfillment of medications to patients enrolled in PAPs or patient assistance programs, and provide pharmacy services support, which is what they are here to talk with us about today. Now, before I pass the mic and the screen to our first panelist, Jenny, I'd like to tell you just a little bit about her and her colleague, John. So Jenny, who's here with us today, brings over 20 years of experience in leading and transforming patient services. And I bet everybody noticed how I really smoothly didn't say her name out loud, because forgive me, I keep butchering both Jenny and John's names. So I thought I just won't say it out loud and let the written name speak for itself. So again, Jenny is here with over 20 years of experience in transforming patient services. She has spent her career in the patient access space. She developed programs ranging from patient assistance and coverage support to cash pay programs and mail order pharmacy services. Since joining Medvantx, Jenny restructured the customer experience team, basically challenging the status quo to provide greater support for clients through process and strategic improvements. As Senior Vice President at Medvantx of Customer Experience, she supports clients by seeking innovative solutions for premier customer experience. She graduated with honors from Rutgers University with a master's in social work and lives in New Jersey with her husband, daughter, son, and rescue pup. Thanks for being here, Jenny. And let's talk just a bit about her colleague, John, who also brings with him a wealth of experience. John is the Associate Director of Pharmacy at Medvantx and has over 15 years of pharmacy management experience. Prior to joining the Medvantx team in 2018, John served as the pharmacy manager and pharmacist in charge at CVS. He is also an adjunct professor at South Dakota State University College of Pharmacy. So you can see why we are so excited to have them take time out of their day to share their expertise with NeedyMeds. And again, today's presentation is being recorded, so you'll be able to share this with friends, family, loved ones, patients, and clients. So I'm going to go ahead and bear with me because I'm going to attempt to pass the screen pretty seamlessly, let's say seamlessly, to Jenny. So she should be able to go ahead and grab that screen. And once she's got her PowerPoint presentation up, which she does lightning fast and makes me look absolutely horrible. So thank you, Jenny, for doing that as simple as breathing. So I'll go ahead and pass the screen and the mic to Jenny so she can take it away. Thanks so much, everybody, for being here and enjoy today's presentation.
Thanks so much, Carla. Appreciate being here. Thanks for having us. So let's talk about patient assistants. We'll do an overview, tell you a bit about what they are and what they're not, what to know and ways to apply. And then we'll turn it over to John, and he'll be talking a bit about pharmacist support for patients as well as pharmacist access. So what are PAPs? What they are charitable programs. They are philanthropic, sponsored by pharmaceutical and biotech companies. Their intent is to provide medication free of charge to people who can't get it otherwise. That means it's designed specifically as a safety net only for people who can't afford their medication and are uninsured. There are a couple programs where underinsured are also assisted, but for the most part, the intent is they can't afford it and they're not insured. And it is free to apply to patient assistance programs, so be mindful of that if you're ever asked to pay to apply to one. Move along and give NeedyMeds a holler, and they can help you get the right application for free. What they're not uniform. Every program's different, and the challenge there is because a lot of different manufacturers run them, and because they're philanthropic, they're not insurance, they're not government run, they're administered very differently. Some have same rules, some have different processes and different rules. It all depends on the product and the company. Also, they're not guaranteed to continue because they are a charity program that the pharmaceutical companies decide to do. There's no guarantee that they'll be here tomorrow. So, but for now, they're still here and they're here to help. Now, although there is a lot of variety in program to program, there are some key areas relative to the enrollment that you'll always see consistently. And that is, there's always an enrollment application. Now, how you get that application might vary. It could be paper, could be a call-in, could go online and find it, enter your information, download, print it, or send it. And then some programs even have a portal that either you or your healthcare provider can complete. And there's typically 3 areas they will look on to determine whether you qualify. There may be more, but these 3 have been pretty consistent since PAPs began. And that is Can you afford it? What's your income? And looking at your income, that can vary. They might ask, they may have a business rule that's set on a flat rate. So if you make more than that, you don't qualify. If you make under that, you do. Some of them follow the US federal poverty level, and they do a percentage of that. Some companies are more generous than others. The federal poverty level is published every year by the government. You can check it online, and most programs are around 300% of the U.S. poverty level. Some are much more. There's still a few that maybe are twice the level, but either way, they'll want to know your income, and it's not just your income, but your household income. The next piece would be insurance. Are you insured? Most programs, you have to be uninsured. Some you can be insured, but as long as you're not insured for that product that you're looking to have them help you with. And other programs, you can be insured, but they'll let you in if your out-of-pocket expenses are so high. For example, you have $5,000 deductible on your medication coverage, so you'll never reach it unless, of course, you have a very, very expensive product. And then the third area to look at is your U.S. status. Some companies, you need to be a citizen. Others, they're not as concerned about you being a citizen, but you do need to prove residency. So now you have the actual application process, and they're going to determine whether or not you're eligible. Each company may go to different lengths to determine that. There's attestation, verification, and investigation. Attestation simply means they're going to take your word for it. If you say you make a certain dollar amount and you sign that application, they're going to take your word for it. You say you're a citizen, they're going to take your word for it. Other companies want a little more evidence, so they look for verification. Can you also not just tell us how much money you make, but please send in some proof of income? What they ask for can vary from company to company, and so make sure you read your instructions well, but they can include a tax return, a pay stub, a 1099. And same with the US status. Some may want your residency proven by showing, sending in a copy of, say, your electric bill that shows your name and address on it. Or in some cases, they want an investigation. They want to go all out and thoroughly confirm that they're going to be the provider of last resort, and they're going to ask for a lot of information on your medical bills, on your income, on your assets. They may use income verification tools that bounce your information off some databases that are national to see if what you say and what is recorded match. They may ask for your green card if you have one, or your social security number, although most companies have moved away from asking for social security number. And the other piece is a prescriber will always be involved in this enrollment process. Without a prescriber, there's no prescription. Without a prescription, there's really no way to request these products for free. So when you're looking over paperwork and you're seeing different words like prescriber, provider, doctor, or healthcare practitioner, sometimes abbreviated as HCP, it's all the same. It's the person who writes your script that has the medication request for you. And they are essential because they need to send in the prescription. Now, sometimes the prescription is part of the enrollment form. Other times it needs to be faxed in. Other times it's part of a portal and can be mailed in. And more and more frequently, patient assistance programs are also accepting e-prescriptions, which most prescribers have access to. Now we go to the insurance piece, and this verification process continues to make sure you are qualified for the program. What's really important is the pharmaceutical companies want to be the provider of last resort. So sometimes what they'll do is they'll have a separate program outside of their PAP where you need to go through that first. And what they want to do there is help you find coverage. You may have coverage, you may have a plan, but there's some barriers to that plan, and they're going to try to get you, access to that and help you through that. Or sometimes they have access to a copay discount card program or a copay foundation to help you with your costs of the product. So not until you've gone through all of that and there's no other option do they then send you over to the patient assistance program for your free medication. Now, some programs you can go straight to the PAP, but either way, you'll need to attest to being uninsured or underinsured, depending on the business rules. And they're going to require insurance information, most likely on the application. Sometimes, again, the evidence of the actual insurance card. Many of them will do a benefit verification check where they run your general information off a database. Some programs will go deeper and they'll actually do outbound calling to your insurance plan, find out all of the details to, again, make absolutely sure they're the provider of last resort. So now you're enrolling and you've answered all of their questions. Most programs have an annual or quarterly enrollment cycle. So if you're approved, usually you're enrolled for a year. Now, if you're a Part D patient, that year ends December 31st. So it doesn't matter if you enrolled in April or August or November. If they approve you, your clock runs out December 31st. And that's a government requirement. They don't allow for a rolling 12 months. If you're not a Part D patient and you're approved, you could typically continue in the program for a year. If you applied in April, you're good through March of the following year. Some require attestation forms and re-verification throughout the year, others don't, which leads to refills. Now, many prescriptions, of course, require refills. Some programs will proactively remind you, either send you a call, an automated call, a chat, a text, depending. So when you are applying, if there's an opt-in on your application and it talks about receiving texts or outreach, you may want to read through that and consider that, because it might include proactively reminding you to refill your medication. Not all programs do this, though, so you'll definitely want to, own that refill process and remember to reach out to place your refill order. And then shipment methods. Most programs now use a mail order pharmacy and will ship either to the patient or the doctor, depending on the product. For example, an infused product is most likely to go to the doctor. However, there are still some programs that ship everything directly to the doctor, and then you need to coordinate with your practitioner to pick up that medicine. Sometimes those products are sent overnight, sometimes they're sent ground, sometimes they're sent 2-day. It varies from company, program, and product. So if you're on more than one program and you see a difference, you're asking yourself, how come I got that one sent overnight and this one took 7 to 10 business days? It has a lot to do with the product itself. If it's temperature sensitive and packed in ice, naturally it's going to go overnight, possibly 2-day. If it's not, there may be an opportunity to send it out ground. Some programs also do signature required, typically for very expensive products. They want to make sure somebody's there and signing for it. And some programs offer delivery setup, where they reach out and confirm that you're going to be there on the date it's looking to be delivered. Not all programs, but that's also something you might find. And the shipment carriers vary as well from company to company and program to program. Everything from USPS to UPS to FedEx. So now that you're enrolling and you want to prepare, I've created this checklist to make sure take a second look at all of the things you had to do when you're enrolling. Read, reread, and read again all the instructions when you've read the instructions for one program, you've only read the instructions for one program because it could be different from company to company. I know I've said that a lot. That's really important. Once you've attached anything that's required to be documented, such as income documentation or copies of your insurance card, make sure you copy both sides, by the way. Make extra copies, have them handy. Sometimes it's not always easy to get to a copier if you don't have one. Sometimes they may ask for your last 4 digits of your social, and they will ask for your household size. And what they're looking there is a count of the number of people living in your home and living under that income. Also make copies of all of your medical expenses if that's required by the instructions, and sign the application in all the areas it asks you to. It's very important because sometimes the applications could be more than one page, and there's several areas you need to sign different sections for. Have yourself get somebody to help you check to make sure everything's complete, and make sure the prescriber is also completing and signing their part of the application. You don't want to miss any of these pieces because that'll just delay the enrollment review to determine if you qualify. And then mark your calendars in advance. If you know the product's a 30-day prescription or a 90-day prescription, give yourself a couple of weeks ahead. Mark your calendar and put a reminder there so you know it's time for a refill. Or if it's the end of your enrollment cycle, give yourself enough time to get all that paperwork together again. And as I mentioned before, you may need to repeat this over and over for different companies. There will be similarities, but there will also be very different forms and ways to enroll. And before I turn it over to John to talk a little bit more about pharmacy services, I did want to share something that we've seen a rise in: alternative funding programs. Sounds so nice, sounds like a great service. Having been in the patient assistance space for a long time, these are rather disheartening. What's happened is the insurance industry, some within the insurance industry, I should say, have recognized that there are free programs for products when a patient doesn't have insurance coverage. So then individuals who are buying and paying for insurance that should have coverage, their plans are denying them and not covering those products because they want to make them go to the patient assistance programs. Wasn't the intent of these programs. These programs were intended to help people who didn't have insurance, and now they're being a bit manipulated in this fashion. So what I wanted to mention is you may find your insurance company that you have drug coverage and a product isn't covered, and they deny you and make you go to a PAP. And some of them actually try to help you into a PAP by filling out the form as much as they can for you, sort of pushing you away from your purchased insurance into these free programs. And these programs now are denying more people with insurance, where in the past they've been able to help them, but they have no choice because that's not how they were designed. So if you get that denial, bring it back to your insurance company and show that as evidence. And typically then they will run an appeal and possibly then cover your product. Hopefully you won't encounter this, but we did want to make you aware since it is a growing trend. So with that, I am going to turn this over to my colleague, John. John?
Thank you, Jenny. One of pharmacists' primary functions that I'm going to speak to is to ensure that medications are safely prescribed and dispensed to patients. Pharmacists are specially trained to get the correct medication and dosing to a patient. They're also acutely aware of barriers and roadblocks that a patient may experience during their treatment. So next, I would like to take you through 4 points highlighting how pharmacists are part of a multidisciplinary team while being highly accessible to patients with medication questions and concerns. Next slide. So first, I'd like to highlight how pharmacy and pharmacists are conveniently positioned to provide patient support to every one of you. Pharmacists empower patients to improve their health. As patients, we often realize that we have questions or concerns after we leave the doctor's office. These questions may come up when we are picking up a new medication or when we are about to take the medication for the first time. Pharmacists are the most successful healthcare practitioners available to you. They are available for questions and concerns over the phone or in person at many times throughout the day and at many points throughout the week. Pharmacists strive to improve patient adherence to medications. Simply having the medication does not mean that we will take the medication or understand how to use that medication. So examples of this is instructing a patient to take a medication at a certain time of day or on an empty stomach. Through counseling and education, a pharmacist is there to improve the patient's understanding of the medication. This understanding helps to control the illness and prevent safety issues and improve the patient's overall understanding. Next slide. So in the previous slide, I mentioned medication adherence, and that's a big word, but a pharmacist and healthcare system want patients to understand that their medications so that they're comfortable enough to take that medication as prescribed. Medications simply don't work in patients who do not take them. Medication adherence is another avenue that pharmacists are positioned to assist in the healthcare field. The pharmacists understand that there are many barriers to why a patient might not take a medication. And some of those examples are the cost of the medication, as Jenny spoke to. It just might be too high, making the medication unaffordable. Pharmacists can guide patients through generics or medications that are in the same drug category but might be cheaper. They can also help a patient find discounts or point them in the direction of a patient assistance program like Jenny just spoke about. And second, a patient might be fearful or unsure of how to take or administer a medication. Take an injectable, for an example. A pharmacist has experience working with a variety of medications, and they can help provide suggestions, advice on resources, and how you can take the medication. And last, patients may have concerns if a new medication fits with the medications they're already taking. Pharmacists can navigate drug-to-drug interactions and provide instruction on how to take certain medications so that they don't interact. And they can also provide suggestions to doctors to change you to a different medication that fits you as a patient. Next slide. So pharmacists help patients take their medications accurately when they provide effective consultations and education. Medicines play an important role in our healthcare. Patient adherence to medications is essential to achieving those great outcomes that we seek. So what can you expect when receiving a consultation from a pharmacist? A pharmacist would be interested in what medications you're already taking, including over-the-counter medications, but they may not have all of that information available to them. It's important for the patient to keep their medical teams, including pharmacists, aware of the medications that are prescribed from various doctors or dispensed by various pharmacies. A complete understanding of your prescription list will help a pharmacist deliver an effective consultation. Second, a pharmacist has the experience to foresee and help you prevent missteps during your treatment. By understanding their patient, a pharmacist can provide recommendations secondary to medication use that may help you manage your condition better. These modifications often include things like diet and exercise, but can include much more. Next slide. Last, pharmacists are very accessible to patients. While there can be more than one way that I listed here below to speak with a pharmacist, typically a patient can access a pharmacist or a pharmacy in one of three convenient ways. First, we're all familiar with our neighborhood pharmacist. Pharmacists and pharmacies all over the country are conveniently located, which makes interacting with a pharmacist easy. Many community and outpatient pharmacies have hours that extend into the evening and over the weekend. Second, pharmacists are available by phone. Community, outpatient, mail order, online pharmacies, they all provide pharmacist consultation services by phone. which adds just one more way that a patient can have a healthcare question answered. And last, many pharmacies, including our own, are moving toward pharmacist access that combine the face-to-face quality of an in-person interaction with the convenience of the phone. This is called telehealth or telepharmacy. With that, I'm going to turn things back over to Jenny.
Thank you. So some key takeaways to wrap this up. Patient assistance programs are free and charitable programs that have a variety of business rules and different ways to access them. Most of them need details on your income, insurance, and US status in order for them to determine whether you meet their individual criteria. A prescriber is needed in order to apply. Typically, you need a prescription in order to apply. Pharmacists are the most accessible healthcare professional and easy to access. It allows patients to not only begin but continue their healthcare journey and have questions answered all along the way. They provide support services that empower and improve their adherence as well as their outcomes. And with that, I'll turn this back over to Carla.
Wonderful. Thank you so much for sharing your expertise with, just bear with me while I go ahead and try and grab the screen back. There we go. Are you guys looking at my screen now?
Not currently.
Not currently. I'm going to give that a shot. Bear with me, everybody. But what I wanted to say while I'm attempting to do this, and as you can see, I don't do it as seamlessly as Jenny does, but we'll talk about that later. But hopefully you guys can see it now. Let's pull that up. You can see that now?
Yes.
All right, not too bad. So again, a reminder to ask questions, and I see a bunch coming in, and we are going to get to as many of those as we can. As I said, we do keep the question segment brief. So if you ask a question and we don't get the chance to answer it, we will follow up with you. But of course, as you can see, I mean, I'm blown away by this presentation because I will tell you, before I started working at NeedyMeds, I was not familiar with patient assistance programs. And once you get familiar with them, they're easy to understand. But having them explained in a clear, concise way is imperative. And this is really invaluable because, as I said, a top reason that NeedyMeds users reach out to us, whether it's through our website or helpline, is to get connected to these really important patient assistance programs. A couple of things I also want to mention. I am so glad we had an opportunity to stress the importance of a pharmacist as a member of your healthcare team. We talk about that a lot at NeedyMeds, and we also host and maintain a website called Medvantx, which is all about the safe use, storage, and disposal of medicines. And we have information about ways to connect with your pharmacist, questions to ask your doctor about medication, and we actually have quite a bit of information about medication adherence, which John touched upon. So that's super important. And a couple of other things I do want to mention before I forget is that Jenny, in the beginning of her presentation, talked about guideline for patient assistance programs and how often income is determined by federal poverty level, or FPL. If you, like me, were not familiar with federal poverty level, and thank you for explaining it, Jenny, you can actually find a federal poverty level, or FPL, calculator on the NeedyMeds website. So check that out. And for those of you joining us that represent a clinic or an organization that helps people apply to PAPs, patient assistance programs, we also have PAP Tracker, which is a software designed by NeedyMeds that can help you and your team eliminate the administrative burden of manually submitting and tracking patient assistance programs. So I'm going to not go on and on because I really want to get to those questions that came in. So super important. What you're looking at on the screen is just a reminder of all of the healthcare savings resources NeedyMeds offers that you can find under that healthcare savings tab, and right at the top, of course, are those patient assistance programs. As promised, I will leave that contact information at the top of on the screen. So as we get to those questions, so let me put that back up. And John and Jenny, I'm just going to go ahead and ask you some questions that came in, and I'll just put them out there, and then you let me know who's comfortable answering them. So let's dive right in. One of the questions that came in was, as a patient who utilizes patient prescription services, as a patient who utilizes prescription services from both mail order and retail pharmacy, is it safe to assume both pharmacies have a complete record of my medications? Great question.
Great question, Carla. Thanks. I'll take that one. In practice, during a patient consultation, the first thing that I would always ask my patients is whether they are taking prescription medication from another pharmacy. So unfortunately, it's not safe to assume that both pharmacies have a complete or up-to-date medication history for you. So a pharmacist needs to know that the medications you are taking, so that they can help determine how they would interact. And this is why patient consultations are so crucial. Consultations allow that pharmacist to engage with the patient, help them, obtain appropriate information, and to ensure that the medication prescribed is that safest therapy option for the patient.
So important. And as you said, if for some reason the question isn't put to the patient, simply sharing that with all the pharmacies and pharmacists you engage with is imperative.
Absolutely.
Thank you for that. And thank you for the question. Another question that came in, we're motoring along here, is what if all my prescription medications come from a mail order pharmacy and I'm not an established patient at a retail pharmacy? Can I ask the retail pharmacist for a consultation? Oh, that's a good one. That's a real good one. Can I ask the retail pharmacist for a consultation if my mail order pharmacy is closed? John, I suspect this one's going to be to you as well.
It is a good question, and absolutely.
You're muted, John.
Oh, bear with me.
Okay.
Hold on, John. John, it looks like you're muted. Are you able to unmute? There you go.
There we go. Yeah,
Perfect.
Turning me off there. I apologize for that. But no, it's a great question, and coming from a retail history, and now being in, patient assistance field, certainly those lines do blur, where a patient will ask us questions in the patient assistance field about, something they might get in the retail sector, and I'm sure that it happens to this day in the other instance as well. But the consultations are not specific to patients or, a specific pharmacy. My advice, again, for a situation like this is to make sure that the pharmacist you are speaking to knows about the other medications you might be taking. That includes the prescription medications, but we can't forget about over-the-counter medications as well, which certainly have, other ingredients and those types of things that can interact with some of our medications. So the most complete and up-to-date medication list that you have to share with your healthcare team members is the recommendation.
Such a great question, and thank you for the thorough answer. And I like, John, how you had an opportunity to touch upon this in your part of the presentation, but that you stressed when you talk about when patients refer to their medication list, it's super important to include everything. I am guilty myself of making other doctors or pharmacists aware of only my prescription meds, and I forget about over-the-counter meds or supplements, which are also really important. So thanks for that. So we're plugging away at these questions coming in, doing our best to get to as many as we can. So this one that came in, listen to this. You mentioned drug-drug interactions. So this question is, can this patient take non-prescription drugs with prescription meds? Good question.
It is a good question. And certainly that happens where we have a seasonal cold or a seasonal allergy, and something over the counter is just what we need, versus taking an appointment with a doctor. But I would always say, with as accessible as a pharmacist is, you should never begin taking a new medication, whether it's an over-the-counter medication or a prescription, without first talking to your physician, or, as we spoke to, how convenient the pharmacist is to get to speaking to a pharmacist. So many non-drugs, including those herbal supplements, those over-the-counter medications, the things that we can find in a pharmacy or even in a health food store, all of those can have potential interactions with prescription medications and lead to unwanted side effects. So again, more information, more up-to-date information that you have for your medical team, that is what's recommended. So great question.
Great question. And again, I'll mention to everybody, and this came up, of course, that an obstacle to compliance and adherence is cost. So please turn to NeedyMeds if you are having trouble affording your medications, or if you're simply looking for a way to save on them. And everything, a lot of the topics that John specifically touched on in today's presentation, and using the pharmacist as a crucial part of your healthcare team, which they are, please check out bmedwise.org for ways to be smart about your medications, both OTCs, supplements, and prescriptions. So keeping this moving forward, another question that came in, and this is we get this at NeedyMeds. We get this question at NeedyMeds. So I'm so glad this is coming up in today's presentation, and that's, why is there so much variation from company to company? Obviously, this is talking about patient assistance program applications. Can't they, or patient assistance programs in general, not only the applications, why can't they make these uniform? Yes, why?
I'll take that one, John.
Thanks, Jenny.
Yeah, I've seen it through the years. It does vary, and there's several reasons. I mean, some of it has to do with something as practical as budget. Some companies have a bigger budget set aside for their philanthropic work, and they're able to donate more product. Others, it's philosophical. Some, they're all in. Some are like, well, we'd like to do more, but we have to we only have this much to work on. So based on that, we have to have stricter maybe business rules, or do a lot less of the user experience things like making outbound calls to remind you about your refills. The other thing is that the pharmaceutical industry is highly regulated, like most industries are. And one of the things that they're very mindful of is something called collusion, where they can work together to a point. After they get to that point, the government might say, that looks like you're getting a little too cozy there. So there have been attempts over the years, I can remember many, where they wanted to create a universal form application, and it constantly fell because of legal reasons, because they need to be unique, distinct companies. And again, because everybody has a different take on how they want to run their programs, there's a variety, because it's not a government program. It's not it's not an insurance. It's one company saying, I'd like to do this, and here's how I'd like to do it. And the next one saying the same thing, but with their own twist on it.
Right. That does make a lot of sense. Unfortunately, as you talked about, Jenny, in your presentation, it makes it difficult for the patient, because, as you said, if you've done one application, you've only done one application. You do not, it's not going to be what the next application looks like. It's not going to be the guidelines. So you need to go through every application. But the good news is that these patient assistance programs do exist.
Right.
And once you are enrolled, they really do offer, from what I've seen, the most by far cost savings for specifically brand name medications. Other cost savings programs really don't parallel the amount you can save with patient assistance programs. So it's absolutely worth investigating. And NeedyMeds, of course, is here to support you to try and connect our users with those patient assistance programs. Thank you so much, Jenny. So we're going to wrap it up with one more question. And I didn't plan this. I didn't plan this, but the question is, where can I find applications and directions?
Well, that's an easy one. Start with NeedyMeds. Start with NeedyMeds. Really, they have a great resource. I've been familiar with them since they started. Definitely tap in their NeedyMeds. So you can reach out to the manufacturers. If you know your manufacturer, go online, type their name. Usually there's a services or support tab. Or if you don't know the manufacturers, but you know the name of the drug, type in the drug name, and sometimes it gives you a link directly to what kind of support services they do have, in addition to patient assistance programs, other services as well. So they're also, of course, a great resource.
Thank you so much. Thank you for that, Jenny. And absolutely, NeedyMeds.org, we understand that our website can be overwhelming, but we are really proud of the breadth and scope of healthcare savings resources we offer. To keep things simple, though, you will, as soon as you visit NeedyMeds.org, you will see a field on the homepage where you can simply type in the name of the medication, whether it's generic or brand name. And it will automatically direct you to cost savings programs and educational resources affiliated with that particular drug, including but not limited to patient assistance programs. The really helpful thing I will say also, and this is something I'm particularly proud of for NeedyMeds, is that once let's say you type in the name of a drug and you find that there are 2 or 3, this is best case scenario, patient assistance programs for a particular brand name drug. The great thing is that on our website, it will also give you the name and the contact information for the organization or program supporting it. So if you have any questions, you can reach out to them directly. You will also find, usually most of the time, a link to the actual application, which is speaking to this question, is where can I find directions and applications? On the outside chance the application isn't there, we'll have directions on how to go about finding it. But really importantly, there will also be a snapshot of eligibility requirements. So our users will be able to know with one quick glance whether they're actually eligible for that patient assistance program. I find that particularly useful because I am super impatient. And if I reached out to an organization and they said, great, here's 3 patient assistance programs available, and then I had to call each one of them just to find out I'm not eligible, especially considering that patient assistance programs would require a little bit of work, that would be super frustrating. So anyway, we do hope that our users, of course, turn to NeedyMeds when they're looking for patient assistance programs, but absolutely, we encourage our users to find cost savings programs anywhere they can, advocate for themselves. So as Jenny said, don't hesitate to reach out to the manufacturer, ask your pharmacist, family and friends, and any cost savings program that you can avail yourself of, absolutely do so. We just ask that you let us know so that we can share it with our users as well. So with that, I want to thank our participants, those attendees that took time out of their day to not only join us for today's presentation, but to participate. And of course, a big thank you to my friends and colleagues, John and Jenny, for sharing their expertise with the NeedyMeds audience. I promised everybody that this was going to be chock full of everything you needed to know about patient assistance programs, and you could see I wasn't kidding, which is why it's really important that today's webinar is recorded. We'll upload it onto our YouTube channel so you can check it out and share it with colleagues, neighbors, friends, loved ones, patients, and clients. And you can revisit this webinar and watch it again in case there's information that you missed. So thank you, everybody. We look forward to seeing everybody's name pop up in future NeedyMeds webinars. Thanks so much and have a wonderful rest of today. Bye.
Bye.